Okay, Assalamu alaikum. First homework will be talking about relevant medications affecting our patient. Okay, so I'm going to do? I'm going to do a Google form, and I'm going to put it in the link of this video. The Google form link, you have to answer these questions. I want from each student 5 medications and how they affect. They either affect the oral situation or the oral condition of the patient, meaning maybe producing reduced saliva, maybe producing some type of lesions, maybe producing increased maybe susceptibility to fungal infections and so on. So there are some oral effects on the oral cavity. And then there are also some general effects on the patient. For example, the patient might become dizzy, might be nauseated, you cannot take impressions, and so on. So there are some direct oral effects, and there are some general effects. For example, the medication should be taken in the morning. The patient should have eaten with the medication, so he would not become dizzy in your clinic or faint in your clinic, and so on. So there might be some oral effects and some medical effects or general effects. What we're talking, you're going to fill them in and make sure that the medications you are dealing with, because you are 7 students, each one take 5 medications at least. You can add more. Make sure in your group you communicate with each other, so nobody will be repeating the same medication. The medications are not for the same, they could be for the same systemic disease. For example, hypertension, you could get some working on the fluids, something working on the glands, maybe, and so on. So you can take for hypertensive drugs multiple drugs, but make it sure that each medication is not the same mechanism of action. If you have generations, talk about the latest generation, not the early generations. Okay, I do not want the medical names. I want the I don't want the commercial names. I want the scientific names. Okay, of the product. And maybe if other similarly, you could say similarly so and so and so medical. You could put their scientific formula or their scientific name. They work on the same principle, and they have, so for this there are other drugs that do the same effect, so also these are included, so similar working drugs. Okay, so the idea is what we want to create. I want to create like a instructional sheet that all dental students can use all around the world. And this will be like a guide. If your patient is taking so and so for so and so, you need to be sure about or be aware about these problems. Okay, so many medications in general patients' health affect the oral cavity, and that's important. Thank you very much.